Hey ladies, my name is Kim Bukta. I'm 47-year-old female wanting to do some videos, hopefully to help women out there in this menopause journey, as there is so much information and it's really confusing and trying to navigate it all can be tough. Um, Again, this is just kind of my journey, and I want everybody to realize that your journey is very individualized. So you have to listen to all the information and do some research and kind of go with what works for you. And it's a trial by error process because it's going to be different for everyone. And I think you need to realize that as you're having everybody tell you different things that you need to do. We need to kind of pick the overall themes we need to try that hopefully will help us get through this better. I am a physician assistant, but definitely not in the women's health, OB-GYN, internal medicine, where I have had any training in any of the perimenopause, menopause symptoms, or nor do I treat these. So this is not medical advice. This is, again, just as my journey and what I've kind of researched and learned. First, I was going to start off by talking about how I've gone through this. My perimenopause started probably about 7 years ago. I had no idea I was in perimenopause, nor had I really heard of it, thought about it, or even considered it at that point. First symptoms were probably the heart palpitations I had. These were like flipping feelings in your chest. Just felt like your heart was like flipping up and almost like would catch your breath and like make you stop breathing. Caused a little bit of chest pain. It was weird. It always happened at night. It's scary. You don't know what's going on, if something bad's happening. So I did get a workup. I had a Holter monitor, which didn't show any concerns. No explanation, did some labs. Everything's fine. Normal variation. Just go about your business. It was kind of the first thing. Then I ended up with these weird eczema patches that would not go away with normal treatment. They were super itchy, and I went to the dermatologist. And they told me it was nummular eczema, and they just said, yep, ladies in their 40s get this. No other real explanation, but again, related to perimenopause, as we're coming to find out. So I have to have these high-dose steroids. It goes away, come back later. Right now they're in my armpits. They're super itchy and annoying. So again, another lovely symptom. I ended up with carpal tunnel in both hands. I just kept getting worse and worse. I eventually ended up having to have surgery for that. I've had like hip pain, and you get x-rays for hip pain. I've had jaw pain, and I had a full workup and ended up getting scoped down my nose to evaluate for that. My reflexes worsened, and I've been evaluated for that. So all these things, again, it's good that, I have an awesome primary care provider who's evaluated me for all my symptoms to make sure nothing bad's going on. But it will be more helpful as doctors are starting to realize this is happening and can kind of put the symptoms together and help women understand that this is probably related to perimenopause and hormone fluctuations, so that you don't think you're going crazy. I mean, I'd never been to a doctor in my life till I was 40, and now all of a sudden I'm going all the time. I feel guilty and weird calling my doctor because I'm thinking I'm going to be bothering them, or I think that they're going to think I'm crazy because I'm calling all the time. So all symptoms I think women feel when they're all of a sudden never going to a doctor and all of a sudden everything is going wrong in their life. So just knowing that these things are happening so that you don't feel alone or that something terrible is going on, I think is a good first step. Again, I feel like you do have to get evaluated to make sure nothing bad is going on, but I think you can feel better that you're not crazy, that these things are happening and it's related to your hormones, not that again, you're a crazy lady. So that was helpful as I started to realize that. When I really figured out I was going through perimenopause was this past year, springtime. All of a sudden I started having horrific hot flashes. I'm like, I'm either dying of cancer or I'm going into menopause. Like, I would wake up just drenched with sweat, and then you're freezing, and this is happening multiple times at night, and it's happening during the day, and then you're not sleeping, and then you're having brain fog, and you're so tired you can't hardly get through your day. And just all of a sudden overnight, you're this soft, pudgy belly that was not there before, and you just don't feel like you're yourself, and you're irritable and angry, and you feel like everything is just driving you crazy, and it's an awful feeling. So I did go to my primary care provider, and we kind of chatted about things, and at that point she checked my levels, which again, nowadays you probably shouldn't be checking levels, because your estrogen and progesterone, your levels are all over the board. So they could check them at one day and it's going to be totally different the next day. But my levels did show with my FSH that it looked like I was postmenopausal, which again, just the standard definition is to be postmenopausal, you have to go without a period for a year. So obviously I had not had that yet, but my hormones showed I'm obviously going through the fluctuations of things. So because of that, she was actually willing to start medication for hormone replacement therapy. But again, you kind of have to push for it, and they make you kind of feel guilty, like, I'm only doing this for your hot flashes. It's not going to help with your weight gain. We're going to do this the shortest amount of time, get you off as quick as we can. So it's kind of a weird visit and making you feel guilty that you're doing it. But she started me on PremPro, which was an older version of hormone replacement therapy. That's what was used back in the Women's Health Initiative, the study that you heard of back in like 2002. It helped right away. Like, I felt way better. Like, I could sleep. My hot flashes stopped. I didn't feel so angry. You just all of a sudden feel like, oh my gosh, I feel back to myself, which is great. Like, I couldn't even tell you how off I'd been until I like got back on that, and I was like, whoa, this is making a huge difference. The unfortunate part is I started bleeding a lot with it. So I hadn't had a period in 4 months, and all of a sudden I'm bleeding every other week. So that was concerning. So I called my primary care provider's office back, and she said, well, we should get an ultrasound. So they sent me for an ultrasound to make sure everything was okay, which is good, just to make sure you don't have any, uterine cancer. But as I'm doing research now, come to find out, like, over 50% of people who start hormone replacement therapy or who change their dose of hormone replacement therapy can bleed or have breakthrough bleeding for 6 months. So they typically don't need to check an ultrasound when you are just first starting hormone therapy, or if you switch your dose on hormone therapy and you have breakthrough bleeding, for at least 6 months. If you're bleeding after 6 months, they say that you should get an ultrasound, but the first 6 months is very normal to have breakthrough bleeding and to have kind of this abnormal bleeding. Not to mention I'm also perimenopausal, so half the periods may be related to the fact that I'm kind of going through these weird hormone fluctuations. So it could be kind of all of the above. But anyway, I wanted to get off this older school formulation because PremPro has higher risk profile. There's higher risk of blood clots, which again, I'd like to not be on the older formulation, and I wanted to get on the newer formulations, which is the more micronized dosing of progesterone and estrogen. So they have the estradiol patches or the micronized progesterone. So then again, it's trying to find a doctor that will do that. So, kind of researching, I went through Mary Claire Haver's site on, people that were certified that, had been able to write for hormone replacement therapy. So I found a clinic in my town that was on the site that said they would listen to people and do this. And again, I think a lot of people, it's just going to be calling. And I think the main thing you should ask when you call is be like, do these providers prescribe hormone replacement therapy, and are they willing to talk to someone about it before you even make an appointment? Because then you won't waste your time with going to see someone. So I got into the OB. Again, I think I went in with high expectations, thinking, it's an OB, she's a midlife woman, she's going to sit down with me for an hour and go over all of this stuff. I forgot that OB is obviously the same thing, busy practices. Everybody gets 15-minute visits with patients. They're busy delivering babies. So again, she was great in the fact of that she switched my medication and kind of went over things with me for that. Which is what I wanted, but didn't kind of go over the overall like health and eating and exercise and all the things you kind of want to hear when you're hitting this stage of life. So some of it I think we have to do on our own with the research, unfortunately, with just the way the medical system is set up. Doctors do not have the time. They're not paid to be able to spend an hour with patients, which is very unfortunate. So doing a lot of research on your own to figure these things out, listening to videos and kind of figuring out what works for you is going to kind of be the main thing I think to help people, is educating yourself. But again, she was able to switch my doses, which was great. So then I got on the estradiol patch and the micronized progesterone. Started it, bleeding got better. I only bled twice over like a month instead of bleeding every other week. But my symptoms came back. My hot flashes were worse. My heart palpitations were back. Things just weren't great again. So when I called, they told me I had to be on it for 3 months, which I was like, whoa, that's a long time to have to see if this is going to work or not. So I ended up making an appointment with MIDI Health, which is an online service that is just for, women's health and going over the hormone replacement. And it was good. It was a 30-minute visit. Again, kind of going over hormone replacement therapy, and they agreed, typically it's on a dose for a month. So you should give something that you're on for a month. And if it's not getting better or your symptoms aren't improved, they should be able to adjust your dose at that month point. So they agreed I should go up higher on the estrogen patch. I was having an appointment with my OB like a week later. So I just held off and thought I'd meet with my OB to see if she would change it, or if I'd have to go back and go through MIDI. MIDI can write for prescriptions, to go through your pharmacy. They can write for labs and tests, to go through the clinics that you want them to do, which is nice. So it's a good resource to have. And I know there's other healthcare services out there that are online for women so that you have options. It's just the unfortunate thing is most of the time the insurance doesn't cover it. They do take some insurances, but I think my visit was $250 that I had to pay out of pocket for. So we've just recently increased my dose. So I'm on the 0.075 of the estradiol patch and 200 of the micronized progesterone. So we'll see if my symptoms get better with that. But again, hormone replacement therapy has hugely helped me. Again, back in April of last year, I just felt awful. So I've come a long ways with just feeling better. I think it's important to meet with a healthcare provider that can go over these options for you. So women hitting this perimenopause, menopause range, they're finding the benefits that you need to start the hormone replacement therapy within 10 years of hitting menopause for it to have the benefit you want, so that you're not too far out from having no estrogen before starting these things. So I think it's really important that everybody has a conversation. Not everybody will want to do it, which is totally a woman's choice. So you just have to hear the pros and cons and figure out if it's going to help you, and then realize it's a trial process. You're not going to get on a dose and it's a miracle. It's a lot of working with your care provider to dose adjust and do all the things to help you with this. So it's been a process, but it's, I'm hoping that we're going to get that right dose and I'm going to feel better. And again, a lot of the research, I'm looking at is showing the benefit of the hormone therapy. Women that have these hot flashes, and I was having like 6 to 10 a day, are at a much higher risk of cardiovascular events. So high risk of stroke and, heart attacks. So I feel like controlling my hot flashes is actually, beneficial and will help me in the long run to prevent those things down the road. Knowing that bone health in the area that I work is hugely beneficial with keeping your hormones. So obviously osteoporosis, when we lose our hormones, our bones weaken. Being on hormone replacement therapy will keep your bones stronger. That is for sure. Women should not wait till they're 65 to get a bone density scan, which is the current recommendation through the medical world. That is way too far past. I mean, I'm 47, so I would be without hormones for 20 years before they would have me get a bone density scan. It's unfortunate, and you might have to pay out of pocket for it, but you should get a bone density scan as soon as you're going through this menopause transition. And then depending on what it shows, if it is normal, I think you can wait 5 years before you get another one. I think if it's abnormal, I think you need to then meet with someone, which would be most likely an endocrinologist, or there are a lot of these bone health groups out there now that are a great resource that would go over information on things to strengthen your bones so that you're not ending up with fractures as you get older. So, and then you would need the bone density scan every 2 years. So again, hormone replacement therapy isn't for everyone, but there are a lot of pros out there for it helping, like I said, bone health. There's data that's showing it's going to be helpful for cardiovascular health. Obviously for genital urinary symptoms, it has helped hugely with like incontinence and those type of symptoms. So there are multiple things out there, but again, you need to meet with the person that's an expert on it. I am just doing reading and research. You want to meet with the OBs that are up to date on that information. And again, there are not a lot of them out there. So if you're not finding one in your community, using these online resources is a great option, because then you can hear about the pros and cons. They can go over the risk-benefit ratio for you and help you figure out if it's right for you. So this is just kind of first video. I figured next videos I'll, talk about how hormones are working. We can go over vaginal estrogen, which I've started. We can go over protein, diet, exercise, supplements, because I'm not only looking in like menopause, perimenopause, but also trying to look at longevity data for just like being healthy and staying active longer. Again, these videos are not medical advice. This is just my experience and what I'm going through, and hoping it will help other women out there, just because there is so much information. It is really hard to navigate what to do right now. So hopefully this helps, and I will post another one soon. Thanks.